When an elderly patient falls and breaks their hip, they usually present to the emergency department and are usually worked up by the ER providers. In a typical ER experience, a patient may wait several hours before being seen by a surgeon. They may lie in bed in pain for several hours, receive more narcotic medication than necessary, and that may increase their delirium while they're in the hospital, their length of stay, and lead to complications that may otherwise be avoided. What's so great about the G60 program is that our patients are seen quickly and their pain is relieved in a timely manner. We did a pilot study looking at these peripheral nerve blocks, the fascia iliacus block for the hip fractures, which did show that these patients took less narcotic medication, had early mobilization, and thus had a decreased length of stay in the hospital. Prior to even be admitted to the hospital, we will place a peripheral nerve block using the on-cue device. It's so important because we know that being elderly, you have decreased reserve. Anything including anesthesia, general anesthesia, narcotic medication, being in a different environment, all of these things lead to delirium. So if we can take one factor out, such as narcotics and opioid medication, then we can decrease the amount of delirium that they have. Also, staying in the hospital for any period of time puts you at risk for multiple complications during your hospital stay. So giving this block to patients provides immediate pain relief, early mobility. This is my favorite procedure, hands down, because the change you see in your patient is so immediate. Before you put the block in, pain 10 out of 10. I mean, a broken hip hurts. Put the block in, immediately patients, wow, I'm pushing on your hip, ma'am, do you feel anything? I don't even feel it. It's immediate, and your patients are so grateful.